Hello everyone, and welcome to this new series. This new series in this as part of this as part of Storm Labostix production. This series in around the Loop remit. This uh this um this audio podcast series as part of a Labostix blocker. This audio podcast as part of a Bostix view, and this audio podcast will be a synopsis in around this works, in around sort of collaborative works from 2016, original works which had been which have been presented at the International Pediatric Nephrology Association in 2016, but also peer reviewed, where works was peer reviewed and published in in a in a in a in a peer review in a peer review journal, a peer reviewed journal, and uh, this works looks at or this audio podcast series will delve into works looking at can social media reduce discrimination and ignorance towards patients with long-standing conditions or long-term conditions, and where this works looks at the example looks at an example around CKD or chronic kidney disease, around chronic kidney disease, but also where this works has a focuses on sort of pediatrics and young people, pediatrics and young people, pediatrics and young people in long-standing conditions and long-term conditions, and also in with sort of disabilities. So this works delves into delves into looking at disabilities, long-standing conditions, long-term conditions, but also the use looks at the use of looks at the use of social media. So this audio podcast will have a synopsis. So long-term conditions or long-standing conditions are increasing in prevalence and cost in Western healthcare. Persons with such conditions or conditions are often unfortunately classed as disabled, are often classed or labeled unfortunately as disabled because of the impacts in around activities surrounding daily life, or secondary consequences of conditions or impairments affecting factors such as mobility, concentration, and communications. Disability needs are often ignored in the design of services and treatment of individuals. It manifests as services which some find difficult to use and lack of personal respect, which then delves into discrimination, and often based on lack of understanding by healthcare profession itself, um, which delves into ignorance. So this works explores the use of social media as an example of assistive technology in an increasingly digital age, and how social media how social media might help. And this the focus is the focus ha- this works has a focus in around CKD, with two specific illustration or examples in the United Kingdom, beginning which have now become more global, have become more global and and support mechanisms now emerging may go well beyond healthcare, and even beyond specific long-standing conditions or long-term conditions, for example, and at the same time, where one of the one of the one of the one of this one of the sort of outcomes of this works was that 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 an English the a reference made to the English Accessible Information Standard may be of use sort of more generally. Again, this works from 2016 was collaborative. There were collaborators between two social media platforms, collaborator from the Health Informatics and Data Accessibility One Voice Coalition for Accessible Information Communication Technology in the United Kingdom, and also from a collaborator based in academia, as well as being involved in as well as being involved in as well as being involved in the National Commission for Persons with Disability, or NCPD. This draws this audio podcast to a close. This is a sort of a synopsis in around this works and where this works will delve into looking at discrimination and ignorance in context of pediatrics and young people, but also in context in pediatrics and young people with long-standing conditions or long-term conditions, and also in around disabilities, and where this works, this peer-reviewed works, looks into or delves into sort of discrimination and ignorance in context of aspects in around healthcare, sort of around healthcare, sort of more succinctly. So thank you for joining and tuning in on this audio podcast as part of the Loope Remit. As part of this Loope Remit, this audio podcast as part of a Labostix Bloca, this audio podcast as part of a Labostix View, and this audio podcast as part of a Store Labostix production.